Hello everybody, I'm Dr. Whitson Lowe and welcome to Urology Associates video instructional series. I'm here today to talk to you for a few minutes about male erectile dysfunction and more specifically about surgical options for the treatment of loss of erections. We see a lot of men here at Urology Associates who are having trouble initiating and maintaining erections, and we of course want them to have a full medical workup. Many times we're able to help men with just medications. The ones we use commonly that you'll see on TV are Cialis, Levitra, Viagra, and most of the time we can get a good result with those. If they're not successful, you can add 2 or 3 other treatments, and we try to use medical treatment and reserve surgical treatment only as a last resort. Injections of the penis are an option. Unfortunately, long term we found that many men really don't use them on a successful basis, and unfortunately they can often lead to penile scarring, so we use that with caution. Vacuum erection devices have been very successful. They're completely safe. We've never had a complication, and I always suggest that they should be tried in conjunction with the medications. There's also some new suppositories that can be used. Sounds unusual to put a suppository in the urethra, but that combination of vacuum erection device, urethral suppository, and the oral PDE5 inhibitors can work very well. And I always suggest that be tried a number of times and make sure that we've really exhausted the medical options until we really want to discuss surgical treatments. Surgical treatment of erectile dysfunction is now a well understood process. It was begun about 30 to 35 years ago, and we're using implants now that have got 20-year track records and essentially a almost non-existent failure rate. Patients really do enjoy them. I must say, at Christmas time I get more letters from patients and patients' wives thanking me for what we've been able to do with a penile implant than I really do about any of the other surgeries I do. It's an outpatient surgery. It generally takes about an hour. It's done through, I use a penis scrotal incision, which is a small incision about 2 inches long in the wrinkly skin where the scrotum joins the base of the penis. And the penile implant is really 2 cylinders that are shaped like cigars, really they're formed like balloons, and they fit into the natural chambers of the penis. They're connected by 2 small tubes to a little pump that then pumps water, sterile water, into the cylinders. So instead of getting an erection with blood, you get an erection with this water that's pumped into the 2 cylinders. They're all completely hidden. If I see a patient in the office who's had a penile implant, unless I examine him carefully, I wouldn't know he's got it in. And if you see your medical doctor, he really wouldn't know. Many of them don't know unless they really have experience knowing what they're going to feel like or look like. They're easy to use. Sex should feel identical. In fact, usually the partners feel like it perhaps is even better because the erection does not go down until you actually take it down. There's a little button on the top of the pump that you can push, and that will, and then the erection goes down. It doesn't change ejaculation. That should feel the same. It's not a very painful procedure. In fact, most people go home on just a couple hours after we do it with oral medications for a couple of days. It is a little bit bruised, and I certainly don't recommend you get on a bicycle or do any major running that first week, but most people can go back to work in 2 or 3 days. The main problems with it are infection. That occurs generally 1 in 100 times to 1 in 200 times. We've been fortunate here. We rarely see it. We always give antibiotics, and That's the one thing we cannot completely eradicate. If that were to happen, it might have to be removed. But other than that, I have never taken one out because of an unhappy patient. So in summary, a penile implant is a great operation. It's got a wonderful track record. It's something that you should only consider once you've looked at all the medical options. It's a lot simpler than you may think, and should last a lifetime. Thank you.